if we needed to do a concept map review is because I want to make sure that everybody's on the same page with this concept map. We want to see progression. So you move, just like you're moving through this program. The first semester, you did things this way. Now we're moving to progression of showing you how you can make connections between the different concepts that's going on with your patient. What I did with this little sheet that's up there for you is I took the rubric. You know, when you have an assignment, it's a good thing to have the rubric right there beside you because that's how we grade, right? So I took the rubric and I went through each one of the rubric requirements and showed you where we're going to have some changes and things that are going to be different. Okay? So in number 1, it's the brainstorming. You know, when you did your assessment of your patient and then you had a piece of paper and you started brainstorming all these nursing diagnoses that might be appropriate for your patient. You did that, right? Most of you didn't include a lot of high risk because Ms. Walker said high risk is not a priority. You're right. High risk is not the highest priority, but it is a priority when we get our patients ready to go home. And isn't that what we're trying to do as they come into the hospital? We want them to get better and things become better. Their ineffective airway clearance is no longer a problem. But he has COPD, so is he at risk for ineffective airway clearance? He is, because he's got COPD. So, and the reason why I want you to include some of those high risk, this is Miss Zimmerman. Miss Zimmerman's really, really pushing me towards this because we need to be very proactive for our patients. If we see this COPD patient who now has gotten better, but we know, as we've learned about COPD, these things happen over and over and over again. So what kind of things can I do as a nurse to help prevent him from coming back in to the hospital? So do you see that you're starting to widen the care of your patient? You're not just focusing on everything that's happening right now. That is a major part of nursing, but one of our biggest parts is I got to teach these people how not to get in the same situation that they're in right now. Now, when I'm talking about prioritizing, are you for State Board of Nursing, for your concept map, for any test that you're taking around here, are you going to have a high risk for a patient that has actual problems as the number one priority? If they've got actual problems, if they've got an airway problem, if they've got a breathing problem, if they've got a circulation problem, those nursing diagnoses, if you're asked to prioritize, are going to be 1, 2, and 3, and 4, and 5, and 6. Okay? My high risk is going to be lower down. Okay, so that has not changed. I just want you to start brainstorming more by including a high risk as well. And we also need to start integrating some psych. Anxiety. I can tell you we're getting ready to go into respiratory, and anxiety is going to be a major nursing diagnosis that you're going to use when a patient can't breathe. And you're going to be able to show, as we go through this concept map, how is that anxiety or that ineffective airway clearance and anxiety, what do they have in common? Not medical. Think medical. What happens when a patient has ineffective airway? What happens with them physically? First, think about vital signs. What usually happens? Heart rate goes up, respiration go up, blood pressure goes down. What do you think happens with anxiety? So is there a correlation there? Ooh. Did you just make a critically thinking connection between two problems that your patient has? Goodness, that's what we're going to do on our concept map. You're going to see you've got ineffective airway clearance and you've got all these signs and symptoms that your patient has. Increased respirations, increased shortness of breath. And then you're going to look over here at anxiety and you're going to say increased respirations, increased heart rate. Oh, Lord have mercy. We're going to connect those. And I'll show you how we're going to connect them in just a little bit. So that's what we're building toward. Do I expect you to be able to do this the first week of clinical? No. Is it something that's going to happen the second day of clinical? Maybe not. But where are you going to get guidance from? Your instructor. Because she's going to say to you, Erin, tell me the connection between this and this. Or tell me, where do you see a connection? This is a process, gang. We've got to learn how to show the connections between these concepts. And I've put on this little list, actually I put somewhere it says use your instructor. Use us. Because this is hard to do at the beginning. Am I going to be grinding in you that you start making these connections? Yes, we are. But don't get upset with yourself if you can't at the very beginning, because it is a process. All right. The other change, I've got the major cotton mouth today. Good old Phentermine. It's helping me lose weight there. All right. You know how we used to, on that concept map, we did a big old circle with all the subjective information and a big old circle with all the subjective and objective, right? I think I said objective twice. Don't put it on there anymore. Take that off. Where are you going to put that information? On the brainstorm. So I still want you to list your subjective information, and I still want you to list your objective, because why do you use that information? To help you formulate. So you're going to still put all that information on there, but I want you to take it off of the circles in the concept map. That's giving me more room, right? Am I going to still put the subjective and objective data on there? I am. But where am I going to put it now? As I put my nursing diagnosis, then I put my related to, then I put my as manifested by. That's where, and I wrote you a little example. See the little example I got there for you? You're going to put that information, objective and subjective, all under which one goes with which nursing diagnosis. Okay? Now, you're going to have several nursing diagnoses, right? Mm-hmm. And you're going to have several little boxes. Let's say we had 3. I just cleaned this, and I really don't want to mess it up. So this one's going to be, and I'll talk about the little lines in a minute. And we got another one over here. It's as manifested by. And we got another one over here. And there's little stuff here, in here, in each one of these. Just like I've written a little circle. A little square. I'm trying to see if I said everything. List the objective. Do not make a box on the mat, and I just said that. All right, remember, if we have a high-risk nursing diagnosis anywhere, do we have as manifested by? You do not have any as manifested. Once you start adding that as manifested by, it now becomes an actual problem. Good. All right, so we've got this, the first part of the brainstorming and the nursing diagnosis and the related to and as manifested by in the first part of it. Any questions? Is everybody with me right now? Okay, good. All right, the second criteria, it needs to be clean, unrolled, blank. There's no change there. Assessment data is complete, integrate, no change there. Teaching plan, you need to make sure on the back that you have included the things that you're going to teach this patient. Did you do that last semester? Yes. Okay. That still needs to be included in that. Or you still need to include that. You're going to see a lot of that for our high-risk nursing diagnoses that you come up with. You need to be looking back to see all those high-risk nursing diagnoses and see what can I teach that patient that will help him not be in the same situation that he's in now. I can teach him to not be around people that during flu season, a big group of people. Because for some reason, everybody, and I'm one like that too, we always want to go to church when we feel bad. Right? Mm-hmm. You know, if we've got the green snot coming out of our nose and we don't really have a fever, but we sort of feel weak, we still want to go to church. Where there's lots of people and we're hugging and we're kissing and we're all in everybody's faces. Oh. So what are we doing? We're sharing the love, but we're also sharing germs. The other day I was at the grocery store with my daughter and I turned around, this woman's just hacking like crazy. And she's got 3 adult kids with her. And I'm thinking, why are you in here? You've got 3 adult kids, give them the list and tell them to go. And as I'm standing over there picking out my yogurt, she comes up right beside me and goes, and I went, and then reached right in there to get her yogurt. I thought, and I turned and let my daughter, I said, you're not supposed to cough in your hands. You know, like that. And I was like, I was about to go off on this lady because I thought, you know what, you're sharing all kinds of junk with people. But think about the people who have COPD. If they came in right after that, then they're just getting so much. So that's the kind of stuff I want to see that you doing. How can we teach people to, yeah, they got to go to the grocery store, but let's try to see a way that we can go. You know, maybe somebody from church can go with you or something like that to try to be. But those are the kinds of things I want to see. All concepts are enclosed. There's no change there. Nursing diagnoses are numbered according to priority. You know that you got to number them. Okay, I said both subjective and objective data are provided. Have y'all seen this information before? Mm-hmm. All right, got the related to and the as manifested. No change there. All right, the meaning, this is a sort of a new, well, it is a new part of this that we added in. Number 9, the meaning of relationships with concept is indicated by connecting lines with linking words. If you see anything that says proposition, mark it out. There's no such thing as a proposition. When we first started this a long, long time ago, somebody used that word, and we just kept thinking, what in the heck does that word mean? What does it mean? It's supposed to be proposition, not preposition. So we mark proposition out everywhere, and we're going to use linking words. Okay, everybody's got a blank look on their face. Okay. I'm going to show you an example. An example is on the first page. If you look, ineffective airway clearance. And do you see that line going to that? And it has related to on there? That is a linking word because this nursing diagnosis is related to this problem. If you also see a line going down that has AMB on it, see it? As manifested by, that is a linking word. You have just linked the nursing diagnosis together. Now, you don't have to make those lines so long, so you'll have more room on your plan. You can just put one little sentence. But I linked that nursing diagnosis with terms that you've already used, correct? Because you've got your nursing diagnosis related to, as manifested by. You have heard that before. Okay? So that's how you're linking these different boxes together. I'm going to show you in a minute how we're going to link some more. Okay, that's why I drew this up. If you look under 9, where I have listed my as manifested bys, I get another box, right? And look what I put underneath that. Nurse will. What am I leading to? Interventions. So am I writing a sentence basically? I'm just saying, here's the nursing diagnosis, it's related to this, it's as manifested by, and because of this nursing diagnosis and because of this problem, actual problem that I have with my patient, this is what I'm going to do as a nurse. So I can say the nurse will, and then what do you think we're going to do next? We're going to see interventions, aren't we? Lots of interventions, because we've got a whole lot more room to do our interventions, right?
Are we still doing like, under the interventions, got the CS, their teach, those 5 things, or we're just throwing the box with it all combined in there?
I don't care how you do it. I don't care how you do it, as long as you have that information, whatever works for you, because remember, this is your plan of care. This is what you're supposed to take care of your patients. If you've got to do a little box here that says assess for and put everything you're going to assess for there, if you've got to put another little box that says monitor, everything that you're on. The reason why I gave you those 5 things is because if you hit those 5 things, you're not going to miss anything when you do your assessment and you do your patient care. Okay? But what I need to see from you now, which I should have saw from you a little bit last semester, is you need to be using your medications that you're giving to your patient. What medications, you know how when you go to the hospital and you have learned those 15 meds, and you see that 9 of those 15 are given because this patient has COPD, right? 9 of them. So if you've got an ineffective airway clearance for your COPD, and you get down and you start looking at your meds, should you not list every med that is going to help your patient that has an ineffective airway clearance? Shouldn't you be telling me that I'm going to do this drug, this drug, this drug, this drug, this drug, this drug, and then you're going to have the times there that you're going to give it. So when you have completed that task, can you put a little check beside it? Is that helping you realize that your plan of care, you're doing it, not just doing it to give it to Miss Walker to grade? You're doing it because you need to know a plan of care of how you're going to take care of your patient. You should technically be able to give this to me, and I should be able to go take care of your patient with no problem. I should know exactly what I need to assess for. I should exactly know what I need to monitor. I should know when the medications I'm going to give and what they are, and you can see how I put on there, administer Solumedrol, 80 milligrams, IV push, Q12 hours. Is there anything missing in that order that would not let me give that medicine? About the times, exactly. So as your plan of care, could you not put, I was supposed to give that at 0900? Right there beside it. So it'll help you plan your care. You know how many meds you need to be given at 9 o'clock. You got me with that? Is everybody with me? Promise? Okay. So we've got some linking words that it's not a magical list of words that you have to put between these to make the linking words. It's what makes sense to you. It's going to make a little bit more sense in just a minute, I hope. Okay? Now, after, let's say I've got the nurse wheel and I've got all my interventions, although that's just a little sorry bit of interventions right there, and I hope to see lots more on your concept map. But if you look down, the neck number 10, it says goals. They have to be measurable. I think one of the biggest things everybody gets so upset about is that you do not meet your goals when you're in clinical. It's okay. Some of our patients will never get better. So don't knock yourself down because you didn't meet your goal for your patient. What I want to see happen is I want you to see this is a very easy, measurable goal. This is what I would like to see happen with my patient. They all need to be smart. How many times have I said that? A bunch. So if I'm going to start looking for some smart goals, if I had a linking word that came, or a link to come, if my nurse will do this, what about my goals? Because I want to, I heard something. Okay, so I've got my linking word, I've got my box here with all my interventions in it. I'm doing my interventions to help me do what? I heard it. To reach my goal. So if I'm doing all this, I could draw arrow down, right? Give me something I can link that from the interventions to the goals. So my patient will have a respiratory rate between 12 and 20. Give me something else that can go on that linking word. I want my patient to do respiration or have. You see where I'm going with this? I'm linking a word because I've got my related tos, I've got my as manifested bys, I've got the nurse is going to do this, and the reason why the nurse is doing this is for my patient to meet these goals. I don't care what words you use. I just want you to say that there's a relationship with what's wrong with my patient, what I'm going to do for my patient, and what can I do to help my patient meet my goals. Okay? Is that making any sense? Because I'm getting a little bit of blank looks on these faces I'm seeing. Speak now, forever hold your peace. Is it making sense? Come on, guys. Talk to me. All right. Number 11. Do not put interventions that are not appropriate for your client. Use your orders. That was another thing Ms. Zimmerman sent to me. She was seeing you're not using your orders. You have got to use your orders because how frequently do you know how to do their patient's vital signs? From your orders, exactly, because it tells you vital signs Q 12 hours or Q 8 hours. So when you put in your interventions, aren't you going to put vital signs Q 8 hours? How do you know what the patient medication order is? No, where'd that mark? From that order. That order was how you knew what to give. How do you know if they can get up? What is their activity level? Where are you going to get it from? Doctor's orders. How do you know if there's a treatment that needs to be done? A dressing change. How do you know? Oh, this patient needs a dressing change. I think I'll just go right in here and do it. Where am I going to get that from? The orders. Your orders is what needs to go on this plan of care so you can make sure that you have carried out everything that needs to be done for your patient. There are many things that we can put on there without orders too. Okay? Lots of things. I've got a patient who's got respiratory problems. What do you think Miss Walker's going to tell you better be on that intervention? Something a little bit, something real simple. My group better say it. Turn, cough, and deep breathe. A doctor may not actually write turn, cough, and deep breathe. But I can tell you, if you've got a respiratory person that's having problems, you better turn these people, you better have them coughing, and you better deep breathe. You've got a post-op patient, you better have them turning, you better have them coughing, and you better have them deep breathing. Right, Liz? I think Liz is agreeing with we better be moving this secretion, right? We've got to. Don't say to me, there's not an order for turn, cough, and deep breathe when you've got a respiratory patient. Because that's something I need to do. And there are going to be many things that you're going to have to put on there that you didn't get from an order. But I got to have you using your orders for things like how frequent do I do these vital signs? What meds do I have? What treatments do I have? Because specifically when you have a dressing change, a very intense dressing change, that doctor's going to tell you exactly what he wants you to use. There's some physicians that'll say, I want a half a cup of saline soaked in a 4x4s, and they're going to tell you specific instructions on how they want that dressing done. That's an intervention, and I got to get it from that orders. Okay, I remember I worked in Lake Norman, and there was one doctor, he would tell you every, step. You do this, and you soak for this long. Then you pull it out and drain it. Then you get a 2x2 and put it on. Very specific instructions. Now some of them just write dressing change Q12. And we have to make that judgment call. But if you've got specific orders, you've got to use those orders. Okay. All right, data from initial. This is first step. Okay, I don't need to read. The initial, I think I've got the initial assessment. When you do your initial one, what I'm saying here is that needs to go in black. Inside. So in other words, it's the box that is my as manifested as. That is my first day assessment. My second day assessment needs to go beside that box in red. Why are we doing it like that? So you can see if there's a change in those, and then you're going to see if the information that you gathered is helping you meet what? Your goal. Okay, so you can put it under the as manifested bys, or you can also put it beside your interventions, because if you look, when I assess for my intervention, I said assess for respirations, breath sounds, cough, cyanosis. There might, now luckily, all four of those things that I assessed, not luckily, but all four of those things I assessed for, if you look in your as manifested by, there was something wrong with it, right? With all, does that mean that's the only four things I assessed with respiratory system? It's not, is it? I would have probably assessed what else? My rhythm, capillary refill. And there are other things that would have been down there that, that I should have assessed for. You can put those in your interventions because it goes with ineffective airway clearance, and then there you can put with like capillary refill. You can just put within 3 seconds besides there. So it gives you another way to put your actual assessment on here. Okay? All right. I don't care what shapes you use. The color key is on there. Do you color? What do we want to see a lot of? Yellow. I need to see a lot of yellow because I want to see that's what you're doing for your patient. The plan is legible. I just put a little note there, help us out. If y'all see me in the office last semester with my magnifying glass, trying to read, and Miss Lowe can attest to that, trying to read, so try to make it where I can read it. Now, Jessica made up a template last year. I don't care if you make up a template and type it on a piece of paper, and then you can just shoot it to me, email. I don't care. If you want to type it, that's perfectly fine. If you're better at that, but if you need to have it written down, that's fine too. I don't care. Just try to help us read it. If I can't read it, I'll just call you in and say, help me out here. These old 50-year-old eyes are bad. Y'all, I'm going to be 50 in 2 months. Having a hard time with this now. So help me out there. All right, the cross links. This is probably one of the biggest things that you're going to have difficulty doing. We talked a little bit about interchanging them and linking words, but I'll tell you, this is where I put that it's difficult at first, so let your instructors guide you. I have given you an example or several examples of the linking words, but the reason why I wanted to really, or I want to show you something, is we're going to have, let's say, respirations were 28, okay? But then you look, this is the ineffective airway clearance, and this one was anxiety. You can draw so you don't have to keep writing it over and again. You can actually draw this to where this increased respirations can go here. And that's this one, and this is as manifested by, and that's as manifested by. So my linking words could be also seen with, because that one, this respirations is actually seen over here. Now that gets a little bit messy. It does get a little bit, but this is how some people want to do it. So if it's linking it that way, that's fine. Where the best place to do this linking is with the interventions. You can do it with the interventions because some of the interventions that you're going to be doing may help other nursing diagnoses. And whether you write it down every time you can, it doesn't matter. But if you want to write here, when I write my interventions down here, if I'm going to assess for respiratory rate, I'm also going to assess for respiratory rate over here, right? So I don't have to write it but one time. Some people do it a big box with every intervention that they have for this patient. Write it one time. And then they take that line and they go up to this nursing diagnosis and they'll say, we'll do with this one, but I'm not going to do it with this one, and then I'm going to draw a line here. Okay? So you can link those two, because I want to see that you are making a connection with this problem and this problem, and how they can go together. I don't care how you link your stuff, whether it's linking your as manifested bys, if it's linking your interventions, I don't care. I just want you to see that connection between the relationship between the different concepts. Is that making any sense? Is your brain fried?
Yes.
All right. Ask me questions. About what? Okay.
I just want to make sure, so you said the linking like that is not required if we choose to write it everywhere, or you still want to see lines from?
I want to see it. I want to see the information. I want to see that you can connect the concepts together. I don't care how you link them or where you write the information. Are you saying if I